what is it they want to ask for to make sure they're getting all the images that would be helpful to somebody like you to see the different parts of the body and what's going on?
So it's going to be an MRI of the abdomen without intravenous contrast. When you have an MRI of the abdomen without intravenous contrast, you are usually going to have 8 to 9 different sequences, and they are going to include the sequences that I've shown you here. You're going to have the T2 without fat suppression, which is the one that we are looking right now and shows the visceral fat white. You're going to have the in and out of phase, which was the one I showed about the liver being extremely dark. So that's going to be enough. You don't need intravenous contrast. It is not done or paid by insurance if your doctor says that it's only for checking for visceral fat. In fact, your radiologist most likely is not going to report visceral fat. But if your provider asks with most likely what you already have, you might have abnormal liver function. You might have elevated triglycerides and HDL. You might have diabetes. You might have abdominal pain. All these reasons could be a cause. All these reasons could be a cause for your provider to order an MRI and get approved by insurance. If by any chance your provider doesn't want to order an MRI or doesn't believe you need it, there is also Dr. Sean O'Mara, who could become your doctor and you would get better even faster. But I would definitely look for metabolic doctors, and Sean O'Mara would be my go-to. And I think you are valuable enough to invest on your health. And as your major asset, your body, the vessel of your soul, sacred. And also, when you have an order, you could check a website called Radiology Assist. And this website gives you a better competitive price for paying MRI out of pocket. And or you could contact clinics or hospitals in your place, in your city, and negotiate the price too. You could say, I'm paying cash and I'm probably going to do this more than once. You need to negotiate for you, right? Be your own advocate. So that's what I would say. MRI of the upper abdomen, no intravenous contrast. If you have any reasons that your provider could order, and I believe you might have because the visceral fat causes all these chronic diseases, you might get the MRI approved by insurance. If not, you could look at Radiology Assist, and you could check Sean O'Mara and take ownership of your life. It's your life. It's your life.
Somebody applying the strategies, what kind of frequency would you recommend to have an MRI done? I'd imagine it's a balance between doing it too early and not seeing the results you expect, and then waiting too long and realizing maybe you're not doing something correctly. So what would you recommend there?
Well, I would say be committed to the strategies, because the exam, the MRI, is not what is going to be telling you if you are following the strategies well or not, right? You know, your own consciousness know if you are following the strategies well or not. What you give is what you get from this life in everything, right? So I would follow my consciousness in doing the strategies as proper as I can, with commitment, compassion, and consistency. I would wait at least 6 to 9 months to repeat the MRI because I could follow my own improvement in my own visual aspect. Like I say, you're going to see decreasing of inflammation. Like I said, you're going to see decreasing of inflammation in your body. Your face is going to be less red. Your abdomen is going to be from protuberant to more oval, flat shaped. Your measurements is going to get better. You're going to feel better energy. You're going to be able to do the strategies in a better way. So I would wait for 6 to 9 months at least. Of course, you could repeat earlier if you want. You could repeat earlier if it's not expensive for you. You could repeat earlier if you want to readjust your path. But again, readjusting your path is really being mindful and honest with you. I would say, do not lie to yourself that you are doing the strategies if you are not. Be honest, and then you're going to know that you're on the right path. I repeated with a year, and that's when I saw the difference from the one to the other, and now I'm going to repeat again, and it's probably like 9 months, but I know that I'm getting better. I know that I'm following the strategies. I can see the difference in my abdominal shape, right? I can see the difference in my energy. So yes. And again, you could always have a doctor following you that will give you the advice, a metabolic doctor, Sean. You could always enroll with him in the Alpha community, and you're going to be in extreme good hands.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
All these problems we are having right now, all of these have been documented that are reversible just by burning your visceral fat. As a radiologist, I see visceral fat in